और कोई भी नहीं है वहाँ पे? नोबडी इज देयर। ओके ओके ओके। हाँ हाँ हाँ, अरे अभी आ गया। हाँ हाँ, ये ऊपर आ गया ना, ये सब सामान अंदर, वहाँ रूम है। देयर इज अ रूम इनसाइड। मैं इधर खड़ा होता हूँ, मैं इधर ही खड़ा हो जाता हूँ, तो तुम ठीक है, तो ऐसा लेते ना। ओके, एक्चुअली सी वी आर वट एवर वी डूइंग, हम लोग ना एवरीथिंग वी सेंड इन द यूट्यूब, सो हम लोग कल से रिहर्स कर रहे हैं फॉर यूट्यूब। माइक भी है, ठीक है? आवाज आ रही? ठीक है, एक बार चला के देखो, आवाज आ रही? चला के आ रही? ठीक है, ओके। थैंक यू। देखो, बहुत ये इट्स अ वेरी इंटरेस्टिंग थिंग, और इट्स एक्चुअली इट विल बी वेरी एजुकेटिव। और क्विज इसलिए कि थोड़ा टू स्टिमुलेट योर माइंड। इफ यू can do it, it's fine. Some ECGs will be very difficult, which you won't be able to do it, so don't worry. जो simple हैं वो that you do, but basically there are only 8 or 10 types of ECG. Number one, normal ECG, and then LVH, RVH, LBB, RBB, entry wall MI, inferior wall MI, heart blocks, first degree, second degree, third degree. ठीक है, these are very simple. But then combination LBB and MI, वो थोड़े that will be difficult. And electrolyte imbalance, hypocalcemia, hyperkalemia will be difficult. So don't worry about that. And there will be one ECG which will be very difficult, and उसके लिए price, there is price of 1000 rupees. जो बोल लेगा और उसको हिंट भी मिल, हाँ नहीं, वो बहुत मुश्किल है, वो नहीं कर पाओगे। ठीक है, सो वी ओके यू सर ने पहले ही भेजा। ओके, सो विल स्टार्ट। ठीक है, ओके। ऐसा कुछ नहीं है कि पहले नॉर्मल है बाद में अब, नथिंग लाइक दैट, इट्स ऑल मिक्सचर। ओके ओके, सो वी स्टार्ट। So this is I don't know myself, मेरे को देखना पड़ेगा, what is this? Okay, so this is a ECG, and I will ask somebody to do it, and if he responds correctly, उसका नाम यहाँ पे नोट हो जाएगा, उसको प्राइज मिलेगा। ठीक है ना? नहीं नहीं नहीं, ऐसा नहीं, जो it's very simple ECG, तो not you, just हाँ। अरे very good, नाम लिख लो। कहाँ है? कोई नाम लिख लो उसका, करेक्ट, हाँ, नाम लिखो उसका। ठीक है, सो दिस इज LVH। वाई? सी सच ह्यूज वोल्टेजेस हियर, देख दो ना, V1 such deep voltages in V2, high voltage V5. So actually the criteria, what is the criteria of LVH? S in V1 and R in V6, V5, V6 more than 33, and they are more like LVF more than 14. तो वो सब तो है, but you have to understand this, and there are some T wave changes. So this is actually part of LVH. So don't think that it's ischemia. And then of course, if it is like hockey stick type, then it is ischemia. If it is just symmetrical, both, like if it is one is more and this is less, then it's ischemic. If it is just symmetrical, it's not ischemic. So ये सब चीजें, but then you have to investigate more, do the echo, see the region bulbous abnormality. So very good. He has one up. First is successful. Okay, next. Okay, next. It looks very difficult, and कुछ और है इसमें। Okay, नहीं वो उसी को लाओ ना, उसी को। Okay, now who will tell this ECG? कौन? Anyway, Ankita. Stand and see. It's also very simple.
There's ST elevation in V1 and V2 also, and V5, V6.
Lateral wall.
Antidote, lateral wall.
Okay, but what about these voltages?
Yes, LVH is also there.
Yeah, it is LVH, but it's a thin young adult with ST elevation there is no chest pain. Okay, so it's called early depolarization, early repolarization syndrome. So you will get confused with early evolving MI. Okay, so and then you do the echo. Whenever you get such ECG, you do the echo and see the regional wall motion abnormality. You can, then of course, if the patient chest pain, do the tropi, तो उससे पता चल जाएगा. But these are generally young fellow 23, and this is very common in the black Africans. Saurabh will know. So this is early repolarization. But then LVH, so she is 50% correct. So just clap one or two times. 50% correct. Okay. So next. Okay, now this is what is this? ECG. Looks again something almost like a thin adult, and okay. Happy, you have to tell this.
Normal.
Yeah, it's
It's there is poor orbit progression. So
RV. So it's normal.
it's it's like a very thin adult, so it looks like an LVH, but it's actually normal ECG. So happy is always correct. Happy. Okay, normal.
This is actually a J point elevation.
There's again, it's like J point elevation, and no, it's little early. Is actually very thin man, so well, it shows like that. Okay. So, ये तो सेम ही ECG था ना, इसके पहले जो दिखाया था तुमने, सेम था. नेक्स्ट, अच्छा, okay, go next. Okay, now what is this? This is little difficult ECG. See it very carefully. See it very carefully, and if you can't sort out the problem, patient is very old, 80 years old, and has blurring of vision. He has sort of pre-syncope. So I think this beautiful Aisha will, she can do it.
RBB.
हाँ,
RBB.
RBB. तुमको बोला था 2:1 ब्लॉक बोलने, तुमने RBB बोल. This 2:1 block. You see, 2 P's, 1 P, 1 P, 1 is 1 P, 1 P, 1 P, 1 P. ठीक है? So, but where is RBB? अच्छा, RBB है भी actually. हाँ, RBB is also okay. Then again, she is 50% correct. She is 50% correct and 50% not correct. So good. So she will get only pen, and then the other surprise she will not get. चलो. So you now okay. I will just, हम लोग इसको ना बीच में ऐसे clinical interpretation भी क्या हो सकता है, what will happen to this man? He's 80 years old, comes with pre-syncope. अचानक he is blurring of vision. This 2:1 block. So what should be the therapy? What you will do? You have to put a pacemaker. Whenever there is a syncope, you have to put a pacemaker. ठीक है? चलो. Next. Come. नेक्स्ट ये है ना. ओके, तो इसको तो पूरा MI दिख रहा है ना, पूरा इवॉल्व MI है. 3 AVR, ये तो बहुत सब नेक्स्ट है. सिर्फ एंटी MI सब MI है. ओके, नाउ दिस विल ओपन. हु विल आंसर? ओपन है. इट्स वेरी कॉमन ECG, आप रोज ER में देखते हो. कॉमन ECG. He came with chest pain and shortness of breath and almost pulmonary edema. Huh?
Left main, AVR escalation.
Left main. Left main, yeah. Left main, yeah. Very, and then of course, and then what else? There are a lot of things here. See, there is a ST elevation here, and then see, it's all evolved MI. Evolved, see, QS. Okay. So this is a extensive MI, and then ST elevation in lead 3. It's very significant of left main disease. So by ECG only you have to be very careful. Like when we do the angiogram, there's no need to sort of engage directly, give a sinus injection. So that is the important. So he is absolutely correct, but he will not get any prize. because he is working in intensive, he should know it. Okay, anyway, sorry. ये देखो ये अच्छा है क्या है इसमें these are again हाँ this one again SLBB and then okay there is nothing else no only B LVH okay so हाँ so you have already answered ये लड़के आ जाओ कौन आएगा बोलने के लिए हाँ आ जाओ
डॉक्टर मंदी
हाँ ओके कौन बोल हाँ मनदीप एनी अदर ड्यूटी डॉक्टर्स RBB okay you are sort of partially correct 50% who else actually it is RVH it is right ventricular hypertrophy but एक चीज देखो you see the P wave its P wave is down and its P mitral so left with P mitral with RVH so what is the diagnosis 30-year-old female mitral stenosis ठीक है this mitral stenosis and you know this all P wave changes and you know so 30-year-old female with this picture severe right ventricular hypertrophy and what is the whenever such patient come you have to see the rhythm what is rhythm is it AF
Silence.
it's not siren okay next okay now what is this this looks very good and this is very difficult ECG you know so कौन बताएगा इसमें ये मोनिका व्हाट इज मोनिका यू कांट हाँ ठीक है हैप्पी नॉर्मल हाँ आ जाओ किसके साथ हाँ इज इट नॉर्मल देख लो अच्छे से हाँ हाइपर एक्टिव P wave
अर्ली बिपोलर
hyper okay so he is absolutely perfect because he knows only normal abnormal तो एक भी नहीं आता उसको तो happy is correct so happy got 2 prizes early का बहुत ज्यादा नहीं है इसके पहले जैसा हमारे पास था जितना वो और आ जाता है you know it comes up to this anyway it looks like normal next but एकदम normal नहीं है एक defect he has missed so he will get 50% what is the defect you have missed see again carefully देखो इसको पूरा rhythm अब rhythm देखो I'll give you a hint see the rhythm is there any ectopics मेरे को लगा कुछ ectopics दिख रहे थे so with respiration is it increasing मेरे को ऐसा लगा कुछ ओके नहीं साइनस वो एक्टॉपिक्स तो नहीं है देयर नो एक्टॉपिक्स हाँ सारे विद यू नो इट्स लाइक गोइंग अप साइनस एनीवे दैट विल बी डिफरेंट नेक्स्ट अब बताओ यू नो नाउ थिंग इट विल बी मोर डिफिकल्ट एंड डिफिकल्ट ओके नेक्स्ट सो नाउ व्हाट इज देयर ओके अब देखो who will answer it's very simple ECG कौन सिंपल ECG ईयर वाले सब समझ जाएंगे ईयर who is working वो तो भाग गया वो आयशा को नहीं बनेगा बन जाएगा हाँ अरे वेरी गुड ओनली बट यू आर half correct what is this it's a lateral wall MI so it's infro आजो it's infro lateral wall MI okay so what artery is involved ये बता दो अब ये you तुम नहीं इसको नहीं ओके सी अच्छा ये देखो दिस इज okay Sabya you just settle down this patient has inferior wall MI and this patient also has lateral wall MI infralateral wall MI now which artery is affected ये बताओ there are 3 arteries LAD RCA and LCX which one and
LCM, sir.
Very good. But again, he will not get any prize because he is supposed to know all this. Huh? चलो
आपने पहले ले लिया है.
अब आ जाओ. ये बहुत इंटरेस्टिंग ईसीजी है. वो मैंने इसको डॉक्टर भल्ला को बोला था बताने के लिए, पूरा दिखा भी दिया था, आए नहीं वो. चलो नहीं, इट्स वेरी गुड ईसीजी.
इसका भी नी रिप्लेसमेंट करना जाएगा.
ओके मनजिंदर, क्या डायग्नोज होता है?
इसीलिए क्या है सर, इसको क्लियर रख दे दो.
हाँ मनजिंदर, इसमें दो चीजें हैं. दो चीज बताओ. ऊपर का कुछ अलग है, नीचे कुछ अलग है. ऊपर बताओ. ए एफ. तो बड़ी मुश्किल है. ऊपर का तो बताओ. ये तो बताओ. ये क्या है? एंटी वॉल V1 है. V1 है. V1.
डॉक्टर भल्ला का आने आगे भी चलती, मैं कह दूंगा नहीं सर ये नहीं हो सकता. वो कहेंगे मैं लोकल में कर दूंगा.
He doesn't want to treat. And what is STEMI? Okay. This patient has antiball MI. Okay. So this is one thing. And then what is this? Next. Dorset is the point. क्यों? We have not given any DIG or any amiodarone. Why do you think it's MI itself? Okay. So it is what? It is VT. Now VT is again classified into sustained and non-sustained. So what is it? Is it really non-sustained? Okay. हाँ, ये कौन होशियार है? Non-sustained. Saurabh, is it sustained or non-sustained? Huh? Non-sustained. No. See, according to the definition, 1 ectopic is 1, 2 is couplet, and 3 is non-sustained VT. 1 is simple, 2 together is couplet, 3 is non-sustained VT, more than 3 is VT. So this is a VT, okay?
It should also be more than 30 seconds, right?
So it's a VT. Now, how do you manage? BP, how do you manage? BP is 110. BP, no, recorder, 110. BP is 110. So what will you do?
So I will
Magnesium.
sulfate.
Magnesium sulfate. What else?
After that we can give amiodarone.
Amiodarone. Okay, what else?
After that we can use
Okay, patient is not reverted. You give shock. Okay, very good. Okay, suppose this ECG, BP is 60. What will you do?
Shock.
So, simple principle, VT, blood pressure below 60, shock. Blood pressure above 100, medical.
So we recently, one patient was managed by Dr. Jaswinder.
हाँ. आ जाओ.
He shocked 7 times the patient. He came with refractive VT.
हाँ, अभी अस्सी तमा को एक ECG सिंपल देंगे अगर उसको प्राइज मिलने का होगा. सिंपल ECG. चलो बैठो, सिंपल बताएंगे तुमको. नेक्स्ट.
So I can only read PQ orders.
PQ नहीं PQ नहीं है, एक बोलना है सर. चलो अच्छा, this is very simple ECG. This simplest ECG. Now you see, it's like it's a self telling. ये खुद diagnosis बोल रही है patient. इसी बताओ ये क्या है? क्या इसको बताओ. देखो क्या है. बहुत इजी ECG है. हाँ, आ जाओ ना, आ जाओ, अंदर आओ. क्या है? अंदर आओ ना, शर्मा क्यों रहे हो? अंदर आओ. वो इट इज सुपर. इट्स मतलब इट्स अ जायंट टेस्ट. हाँ, इट्स MI. इट्स anterior wall. So it's anterior wall acute MI. And it is must be. How many hours? This chest pain is now. What do you think? How many hours of chest pain? Is it 6 hours? Or is it 8 hours? It is 1 hour, 1 or 2 hours. Such ECG. Okay, then okay. So what you will do? Asitama to ENT. उसको टिम्पेनोप्लास्टी treatment. No. Okay, ना तुम नहीं बोल रहे यार. तुम उधर से तुम नहीं. ये आयशा treatment. Aisha. Very good. Now this patient has come within 2 hours. ठीक है. This patient has come within 2 hours.
Yes, sir.
Okay, so what will you do?
So we have to try loading dose.
Primary PCI.
Or primary
Then
PCI.
primary PCI.
अच्छा, ठीक है. Now this patient is not here. He is not in Firozpur. He has come from Chandigarh. He is coming. 4 घंटे. तो क्या करोगे? Thrombolize and then give. Now what is the best? You have to put the patient. You have to put the patient in the ambulance and send it. You cannot really do the BPP kitna kya hai. So what thrombolytic you will prefer? You will give L-taplase or you will give STK? Kya doge? L-tap. All the trials are done with L-taplase, just, and then the results are very good. It's called pharmaco-invasive therapy. ठीक है ना? So whenever the gap is more than 2 hours, you give L-taplase. Okay, so this is the thing, and then do PCA next. So Ashitama is correct. ENT तो उसको full price मिलेगा पूरा, हाँ पूरा. So now this is very interesting. Now it will become more difficult. Now if you tell this, then you get the prize. Okay, Mudar sir, ये देखो. अब इसमें देखो ये ECG है. The QT is more. Okay, and then this is the ECG after treatment. QTs become normalized, so less. Tell me what is the diagnosis? Hypokalemia. QT. QT is hypokalemia. नहीं. Or anything else? Hypo. It is hypocalcemia. ये बताओ सबसे पहले QT prolonged. Is it hypocalcemia or hyper? It is hypercalcemia. Okay, hypercalcemia, and generally it's should be hypokalemia, renal failure, वो सब होता है. And then once treated, this is hypocalcemia. This is corrected, and now this is hypocalcemia. Okay, so this is hypocalcemia, and this is hypocalcemia. Okay, so this is a good thing. We have some time. I'll just tell you one story, very interesting story. I got a patient. I got a patient in Dubai. One lady, she fought with her husband. Okay, and then she came with एकदम zero BP, no BP, and looks comfortable but zero BP. उसको हम लोगों ने ran dopamine drip पूरा दे दिया, NORAD दे दिया, सब दे दिया, कुछ BP बढ़ता ही नहीं उसका. तो and then the ECG was something like this one, you know. This was simple. एको सब normal, so everything is good. और कुछ भी दे उसका BP बढ़ता ही नहीं, and otherwise looks nice. तो I was just, I never faced such problem. मैंने देखा ही नहीं कभी. So, but we had a female doctor, and all the females are big spies, you know. वो बहुत, मैं जब वहाँ पे मैनेज कर रहा हूँ ना, उसने क्या किया, वो उसके हस्बैंड को लेके गई.
आपकी वाइफ यहाँ पे है.
all the ladies are born spy. They are born suspicion. They are very good CBI agent. हाँ, very उन लोग तो देख के समझ में आता है कि किस आदमी ने लड़की से बात की नहीं की, सब करके आ जाता है उन लोग. तो वो गई, मालूम क्या किया, she went and called the husband and उनसे बोला कि भाई कुछ बात है, जबकि कोई रिलेटेड नहीं, तो कोई झगड़ा तो नहीं हुआ. तो नहीं, बहुत झगड़ा हो गया. फिर क्या हुआ, तो that husband was taking isoptin 240. तो ये 2-3 खा गई है, तो खा गई है. तो हम लोगों ने भी आइसोप्टिन नहीं ना, बीटा ब्लॉकर नहीं, कैल्शियम चैनल ब्लॉकर. तो दिस हैपेंड. तो हम लोगों ने कैल्शियम चला टॉक्सिसिटी क्या किया, हम लोगों ने ओपन द मेडिकल इमरजेंसीज. सिंपल कैल्शियम ग्लूकोनेट. आई टेल यू, we gave 10 ml of calcium gluconate, BP 110.
So that's why
So you always have female. The lesson is always have female medical officers. I tell you, because वो आपको सब बता देंगे क्या क्या है. Okay, so next come. Now this is एक दूसरा भी देखो. This is one ECG. I won't think you will. देख लो क्या है इसको. What is this ECG? ये इससे पता नहीं चलेगा. What? See this one. See L1, broad QRS and L1. LBB. LBB. This is LBB. Actually, this is a case of. I don't think you will be able to know. It's a CRTD case we have recently done. Next. And once we have done, see, this is the post CRT. See the kitna ho.
Sir, I'm going to excuse myself, sir. I have a case in
हाँ, but you got a prize, आके collect करना. अब आज थोड़ी देर बाद आके पिज़्ज़ा दे दो ना, कहा गया संजीव, इनको एक पिज़्ज़ा दे दो. अच्छा ठीक है. Okay, so this, see, the QRS has normalized. See, such a good response. You know, how do you know that the CRT has worked? The QRS becomes almost normal, and there is a spike. See, this is atrial sensitivity and ventricular pacing, so it's very good. So it's working, you know. So okay, next.
सर आपने इसकी लो रेट लिमिट क्या रखी है सर? 88 क्यों बता रहे हैं?
ना इसका 80.
चलिए सर, दिस इज नॉट रियली वर्किंग।
ना इट्स ना एक जो है ना जो हाँ पेशेंट का जो भी रेट रहेगा ना वही रहेगा क्योंकि इट्स एट्रियल नॉर्मल, एट्रियल सेंसिटिविटी, वेंट्रिकुलर पेसिंग, ठीक है ना। तो जो एट्रियल उसकी 88 है वो उसने पेस किया वो 88 का फिर रेट लेगा वो उसको। सो एंड इट्स बेसिकली वी वांट टू सी दैट बोथ द लीड्स आर पेसिंग, ठीक है ना वो सब। ओके, अब नेक्स्ट आल्सो क्वाइट इजी। कहाँ गया? आई थिंक लेट मी आस्क माय टीम मंजिंदर व्हाट इज दिस ईसीजी?
LVB sir.
अरे वेरी गुड। So cath lab staff is very good, very smart, so he will get double prize और दो जो भी है। चलो वेरी गुड। अच्छा डायग्नोसिस बताओ, व्हाट इज डायग्नोसिस? एलवीबी है तो क्या डायग्नोसिस हो सकता है? डायग्नोसिस
I think it is SVT with aberrancy.
एसवीटी नो रेट तो उतना नॉर्मल नहीं दिख रहा है, but it may be AF associated because थोड़ा सा irregular लग रहा है, it may be AF। Okay, so what is the diagnosis? Diagnosis क्या है? Diagnosis जनरली LV में क्या होता है? नहीं, that's less chance. I mean you ask the clinical picture. If the patient has chest pain 4-5 घंटे, then it's possible. Suppose no, he shortness of breath for 6 months. Shortness of breath for 6 months. Diagnosis dilated cardiac. Okay, now this is also very good ECG, बहुत easy ECG है। Duty doctor। अरे तो Aisha is much more intelligent than I thought, ना? कि Aisha is much more intelligent than I thought यार। Very good। अच्छा और बताओ, अच्छा और क्या है इसमें? What else is there? Something more is there. Inferior MI and what else?
Posterior wall
Posterior, right side.
Posterior की right?
Right side.
Right ventricular MI, RVMI. See, VR है देखो, V4R। This is right ventricular MI. Okay, so actually whenever you have inferior MI, always take the right side because the treatment changes. What happens? Suppose the BP is low, 80. BP is low in this patient. What will you do? Fluid, because RV is not going to give you a lot of fluid, 2, 3, 4 liters of fluid. Okay, next. What is this next? Again, ये देखो ये day 1, day 2. Okay, this is very interesting ECG. Okay, now you see this is a electrolyte imbalance. Okay, ये देखो ये बहुत very high like first day. This is after treatment. This is the first day after treatment. What is this? Tell me. Anyone can find electrolyte balance 4 ही होता है, हाइपरकैलेमिया, हाइपोकैल्सीमिया, हाइपोकैल्सीमिया। तो इसमें क्या है ये? Hyperkalemia. Okay, actually this you will not see much because this is the terminal when the potassium is 9 or something, but this is very common. ये 6-7 पे आ जाएगा, tented T, and before after that this, and after that hyperkalemia. Next what happens? Suppose 12, what will happen? Asystole. Okay, now if you answer this question you will again get a prize. Now it will arrest heart in systole or diastole. Okay, very good. Okay. Okay, next this one. What is this? This is C. This is very deep. Like this also electrolyte imbalance. ST down. What is this? Hypokalemia. And this after treatment. Okay, treatment it's normalized. Okay, next. Now again you see this is a very interesting ECG, and I don't know, you can just think about 1 minute. Can you diagnose?
ERS.
हाँ?
ERS
ERS
WPW short clear interval.
ऐसा लगता है WPW, but the delta wave is not very prominent. You keep a good suspicion. Next.
Early repolarization can it be? ERS.
Early repolarization, but the patient has fever and chest pain. Pericarditis. Very good. Again. But this is simple for you, so no prize for you. Next. Okay, now next, what is this? This is a very interesting ECG. Patient has mitral valve disease and patient is on medication. Now this is a side effect of the medication. Now I've already given you the hint.
Digoxin toxicity.
Digoxin toxicity. Okay. Patient has AF. Patient has AF. Patient has T wave changes and all that. So you have to sort of. What will you give? क्या करोगे? How do you diagnose this?
Digiband.
Digiband. How much? What will be the level? कितना level होना चाहिए? Above 2 microgram. And then what you give? कैसे करोगे? क्या treat? Antibody. So okay, next. Okay, this is who will say? This looks simple, but it's not that simple. Ankita. Yeah. Monica. This one thing is very clear. Huh? This one thing is very clear. The white QR, LVB.
LBB is
But and there is something besides LVB. The Q waves. This is anti-wall MI. Leading to LVB.
can
Next.
it be dilated cardiomyopathy also because artery progression is poor and
Q waves are indicator of MI. ठीक है नहीं इसको. Next. Okay, now this is also very simple. ये तो बहुत simple है. कौन बताए? ER वाले कौन? तुम बताओ ये. तुम बताओ. हाँ. क्या है? हार्ट अटैक है, बताओ कौन सा है? हाँ. क्या कौन सा सेप? C23 AVF देखो ना. 23 AVF.
इसमें V2 है सर. V2
अच्छा ये V2 है. Okay. V2 है. Sorry. So this is what? But this is MI. So anti-wall MI. ठीक है. Now what is the duration of MI? More than at least 1 day. Q waves have come. So will you thrombolize or will you do thrombolize? तो करना ही नहीं है. PTCA you can think of doing PTCA. Okay. Sorry. Next. Now what is this? This also looks very. Oh, this is very good. This is very good. It is. Okay. It's 2:1 block. Or is it complete heart block? PR सब में. Is it? ये 2:1. It's 2:1 block. Patient has blurring of vision. 80-year-old. क्या करोगे?
सर TPM डायरेक्ट फ्लोरस ब्रॉड नहीं है. Would prefer
TPI.
TPI and will be.
Then 80-year-old. तो अब what pacemaker? अच्छा, what pacemaker now? 80-year-old, what pacemaker? His activity is very limited. He doesn't walk much. See, he doesn't afford. So best is VVI. If he's a very sort of rich man and active, so DD. Okay. And so will you put VVI or VVIR? Rate responsive. Put rate responsive. Next. Next. Okay, again ये तो हो गया. Next. Okay, ये क्या है यार? This is very interesting ECG. देखो भैया. अरे वाह यार, very good. Pulsar देखो ना, one QRS is big, one down, one QRS. Okay, but now you have to tell me the diagnosis. Tell what is the diagnosis?
It can be seen in left ventricular failure also, and also cardiac pericardial effusion.
Pericardial effusion. This is a typical symptom of pericardial tamponade. तो इसका मतलब है immediate take to care. Okay, she get triple price. She get 2 pens and all the things. बहुत कौन सा?
जो डॉक्टर आरपी से बात की थी आपने.
कौन सा?
जो
वो तो कहाँ गया वो अच्छा केस था. चलो next. This is no, ये छोटे वो नहीं, ये तो easy है. मनप्रीत. सोच के बताओ. अच्छा, VF, it's like VF, VT, very good. And actually the cause is torsade, but anyway. तो इसको क्या treatment क्या करोगे इसका? अच्छा, what will be the pulse in this patient? BP कितना रहेगा? BP
Unrecordable.
not recordable. And treatment? Shock. So next. And what else is this now? ये क्या है? V3-4 ऐसा. Look like normal. Okay, तो old anti-wall MI. Old anti-wall MI. Come, go ahead. Okay, and this, what is this? अच्छा, this is again, you see, this is a very good case of diagnosis. RVH, mitral left atrial enlargement, mitral, this RVH diagnosis, mitral stenosis, and is it AF? Is it AF? No, no. Okay, next. And this is again, acha, this is very interesting ECG. See, this is the baseline ECG. Baseline, T-wave changes. Patient has angina, and see the ECG is normalized. So some patient comes with normal ECG, doesn't think, always ask for the previous ECG. If the previous ECG has T inversions and normalized, that's also a feature of ischemia. Next, this one. So when the when the chest pain resolved, and the next again, then who will say कोई simple आदमी, चलो GPs यहाँ देखो, GPs Monica, हाँ, left bundle branch block, because see V6 like that, left bundle block, cause LBB causes cardiomyopathy. Next. Okay, and this is what, हाँ, अब ये बताओ, ये बहुत interesting ECG है, ये पकड़ना मुश्किल है. What is, tell me, what is the diagnosis? It's difficult ECG, huh? Okay, see, this is a Q waves, ऐसा है. Okay, this is a Q wave, this is AVF Q waves. So what is the diagnosis? Patient doesn't have chest pain, no chest pain. He has some difficulty in breathing.
Late presentation.
Young patient, 35-year-old. This pattern. WP तो नहीं है ना, कहाँ है WP? नहीं, यहाँ कहाँ है? There's nothing, nothing. Okay, this is hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy can mimic inferior MI, it can mimic anterior MI, everything. So it's hypertrophic cardiomyopathy. You can easily find out from the echo that very enlarged septum and all. Next. अच्छा, ये तो हमारा शायद वो था ना, क्या था ये? Again, see the 2-3 AVF, and so what is the diagnosis? 2-3 AVF, inferior volume. Next. Okay, so this is the star ECG. जो इसको पढ़ लेगा, he gets 1,000 rupees. ठीक है, एक मिनट थोड़ा इसको सुन लेना. Okay, 1,000 rupees, एकदम कैश, पैसे मैं जेब में निकाल कर रखता हूँ. ठीक है ना, पूरे देखो ये मुदस्सर पैसे यहाँ पे. हाँ, सौरभ, this is the ECG price of 1,000 rupees. Whoever answers this question. Okay.
It's Osborne waves.
Osborne waves. Okay. Partly. So diagnose. Tell the diagnosis.
Hypothermia.
Oh yeah. तुम लोगों ने सर. Anyway, next.
Hypothermia.
देखा उसको. ठीक है, you can find out. This is hypothermia. Next. So you know how he died. So दिखा उसको. Now you know it's not. You have to tell his name. What is his name?
Jack Dawson.
No, Don Caprio. Don. Okay, or he died of, what was the temperature in Atlantic?
-7.
-20. And why she died or she didn't die?
She survived, sir.
She survived.
2 years.
And did she marry again?
No.
No, I didn't. Okay.
gave birth to
Okay, it was a wonderful love story and I always liked it.
Yes,
So, okay. So, anyway, very good hypothermia. Both you get 50-50. Okay. But it was different. कोई नहीं बता पाता, तुम लोगों ने कैसे बता दिए हाइपोथर्मिया?
सर मैंने देखी हुई है, हरियाणा में बहुत देखे हाइपोथर्मिया पेशेंट्स. I have seen. No, I have actually seen. हरियाणा में they come in विलेज में आते हैं ना. वो आते हैं सर हाइपोथर्मिया में.
मैं तो आज तक मैंने क्या कोई नहीं बता
No, I've
पाया.
seen many cities of hypothermia.
Okay, so प्राइस ले आओ जरा. पेन सबको पेन दो ये सर्विस का पेन. और बुक ले आओ. सौरभ, बिफोर पिज्जा इज जस्ट. पिज्जा सबको, पिज्जा फास्ट. गेट अप, मनप्रीत गेट अप, सबको पिज्जा दे दो सबको। चलो छोड़ो उसको, लाओ भागवती का लाओ।